Welcome to the COVID-19 Compliance Officer course brought to you by OHSS Savvy Consulting. We are going to cover 5 areas in Section 2. Number 1, the key challenges to overcome. Number 2, the available supports. Number 3, policies and checklists. Number 4, risk assessment and monitoring control. And lastly, deep clean and infection prevention and control. The first and biggest challenge is to know where to find accurate and valid information to assist you in implementing a prevention system. Questions you might ask yourself is where to find resources, who is responsible for what part of the management system, where do you get the assistance, and also what PPE do you need. Now, after finding the correct source of information, you now have the challenge of getting started. What do you do first? Many ask the question that they are trained in safety and risk assessment, but perhaps you do not know how it is done. Does this mean you might need to go for additional training? What about those who are elderly or high risk and those who work from home? When we have a positive case, a symptomatic person, or an issue about refusal to work due to exposure to COVID-19, how do you resolve the situation while still ensuring a thriving business? Here's a recommendation for when you get started with your COVID-19 management plan. Create a COVID-19 team. Encourage as many as possible to be involved. This way, the training experience will be more effective. Utilize the resources available to businesses and ensure you are always informed of the latest updated COVID-19 information by visiting www.sacoronavirus.co.za. So where can you find the available supports and accurate information to give you and your company an effective COVID-19 management plan? You may use the See More online submission portal for COVID-19. To request more information, please contact Chris at ohss.co.za. You can call the COVID-19 hotline or type hello to the WhatsApp number for COVID-19. As mentioned earlier, you can also visit the website at www.sacoronavirus.co.za. To perform a health check from your phone, simply dial *134 *832# and follow the prompts that are given. Please also visit the following 2 websites: the National Institute of Communicable Diseases as well as the National Department of Health for more updated information on the COVID-19 virus. For those of you who require assistance with template documents, these will be available for almost all implementation phases you will need. These will include procedures, risk assessments, screening registers, rotational work registers, monitoring registers, and checklists. To receive more information, please email info@ohss.co.za. So we have just answered 2 of your questions: where to find resources and how to get assistance. Now it is up to you to take advantage of the resources and assistance offered and get yourself ready to implement a compliant and effective COVID-19 prevention program. Need more assistance? Get in contact with us today. Some of the resources that you will need are policies and checklists. To start off, you will need to design a COVID-19 policy for your company. What are your targets and goals to achieve a prevention program? Then, you will need to ensure you have the necessary resource documents so that you can design procedures to ensure prevention measures. These will include measures for pre- and post-COVID-19 cases. This will make up the majority of your COVID-19 compliance system or COVID-19 plan. As a COVID-19 compliance officer, it will be your task to monitor and review the effectiveness of the above policies, procedures, and ultimately the entire plan for prevention. Here is a recommendation. Create a COVID-19 file, but do not clutter it with non-essential information like the entire legislation for all levels of lockdown. Keep only what you need to ensure continued adherence to the latest regulations. Set up a calendar of events for yourself and the staff. Use technology to your advantage. Create reminders via email or use the broadcast option to send one message to all staff via WhatsApp. Ensure you have daily, weekly, and monthly tasks set up in advance, along with reminders for yourself and those who need to complete certain documentation. When it comes to the risk assessment program, there are 4 types of risk assessments that you will need to work with. The first one is an occupational health and safety risk assessment. The second is your COVID-19 risk assessment of employees, as well as the COVID-19 walkthrough risk assessment, and then finally the Post-Covert risk assessment. This would be a review of risk assessment 1, the OHSS risk assessment, and risk assessment 2, the risk assessment of employees. All of these templates are available for you on the COVID-19 Management Plan template format available from OHSS Consulting. The OHS risk assessment, developed by the risk assessor in terms of the Occupational Health and Safety Act Section 8.2d, must include information on pre- and post-COVID-19 procedures. This must also be communicated to all staff and regularly reviewed and monitored for effectiveness. Continuing on with the risk assessment program, please ensure you have the COVID-19 risk assessment for employees. This template is issued by the National Department of Health. Answer all 19 questions and report on any inconsistencies if necessary. The COVID-19 walkthrough risk assessment helps us to identify and assess the potential risk of exposure of employees to SARS-CoV-2 virus at a workplace. It also helps to identify control measures, or the absence of control measures, and assess their effectiveness to prevent exposure. This document also helps to inform the management of the risk of potential exposure of employees to the SARS-CoV-2 virus and additional controls that may be required. Should you have a positive COVID case, a post-COVID risk assessment must be done. You will need to update all previous risk assessments and check for gaps or non-conformances and adjust your risk strategy. As a COVID-19 compliance officer, you may need to carry out certain additional functions within your area of responsibility. This is to ensure continued monitoring control. You need to check whether screening is being done daily. Are employees, visitors, and others wearing their masks? Is the 1.5-meter social distancing measures being adhered to? You will need to check if registers and checklists are being completed, such as your hygiene, disinfection, or PPE checklists. Ensure an isolation area is available for any person who needs to be isolated due to symptoms of SARS-CoV-2. Then, you will also need to check levels and amounts of sanitizers that are available to your employees, visitors, and any person visiting your work area. Perhaps you might be asking yourself, what can help me to carry out my responsibility? Here are some suggestions. Have a set calendar of events, and don't forget to set up your reminders. Ensure you have copies of all registers and checklists that are available. Keep all resources available at each worksite, perhaps on a digital platform. Ask for assistance. Perhaps the housekeeper can perform the hygiene inspection for you. However, please note, it must always be checked afterward for quality and effectiveness. Then, do not get discouraged. Just get started. You always have the option of contacting the National Institute for Communicable Diseases, the National Department of Health, as well as ourselves at the Occupational Health and Safety Savvy Consulting. When must deep cleaning be done? Before opening after a long period of time, including after any lockdown period, as well as after a positive COVID-19 case. Please ensure your office and equipment, bathrooms and toilets, kitchens and canteens, as well as boardrooms are thoroughly deep cleaned. For a copy of a standard, safe operating procedure for deep cleaning, please contact OHSS for the relevant documentation as well as checklists to ensure your entire office is kept clean. The need to ensure an effective infection prevention and control system is vital. To prevent the spread of COVID-19, each person must take responsibility for their area of work as well as look after their own health. How do you achieve this as a compliance officer? Make sure all employees are aware of what the protocols are. Continually remind them of these protocols by means of posters, info packs, and toolbox talks. Do your daily, weekly, and monthly checks and determine the effectiveness by identifying potential exposure or potential positive cases, including symptomatic persons. Ensure all protocols are adhered to by employees by monitoring and administrative measures. All employers, including compliance officers, must promote hand washing, self-hygiene, disinfection and sanitizing at the office, at homes, and when in public areas. Whose responsibility is it to carry out the COVID-19 compliance plan? Ultimately, the employer is responsible for the implementation and continued prevention of COVID-19 in a workplace. Compliance officers assist the employer in their responsibility by acting as a monitor as well as an implementer of COVID-19 compliance systems. This will include ensuring all information for positive cases is reported. COID cases are captured correctly and employees receive the correct compensation. Employees are obligated to adhere to the South African legislation for COVID-19 prevention as well as your own company's protocols. But do not underestimate the need for continual training of employees. Let's recap. Where can you find resources? Request a link to the OHSS Dropbox folder, which will have resources and templates available for you. Alternatively, visit the following websites: sacoronavirus.co.za, nicd.ac.za, health.gov.za, or who.org. Employers are required to provide, ensure adherence to, and enforce any measures as required by the directives in an effort to prevent the spread of COVID-19. As a compliance officer, you are required to provide support in a monitoring and implementation area of responsibility, and all employees are obligated to adhere to these and company-specific directives and protocols on COVID-19 prevention. Risk assessments must be carried out continually and checked for effectiveness when there is a positive COVID case. You may need to attend a HIRA course or hazard identification and risk assessment to effectively conduct a risk assessment. For assistance with this, please contact us on info@ohss.co.za. For additional resources, please make use of the CMOR online reporting program for all screening, positive, or vulnerable cases. To get more information, please reach out to us or locate the information on the NICD or NDOH websites. Thank you for completing Section 2 of this COVID-19 Compliance Officers course. Link to Section 3 will be sent to you shortly.